Hey everyone, welcome back to Love, Food and Fitness. I'm your host Archna, and today we are opening our mouths, literally and figuratively, because what goes inside your mouth is a lot that tells us about what's going inside our body. Think about it, we all brush every day, we're supposed to do that. We floss also, but occasionally. But how many of us truly understand that the relation between oral hygiene and our overall health? Which includes digestion, which includes immunity, which includes even the way we sleep. So today, joining me today to discuss about this is a powerhouse in dentistry, Dr. Anupam Bhargava, a senior dental surgeon with a gold medal in BDS, an MDS from BHU, and decades of clinical experience. He is an expert in endodontics, restorative dentistry, implants, lasers, and also a passionate educator who helps young dentists bridge the gap between the textbook learning and the real life dentistry. Welcome, Dr. Bhargav.
Thank you. Thank you very much,
It's
Archana
really an
ji.
honor to have you here, actually. Let me start with that.
Thank you so much, Archana ji, and it's an honor and pleasure for me for you giving me this opportunity to share with fellows around us
Yes.
and try to share with them what has been told to me by my masters from my teachers. And I just recalled you just in your introduction you said that opening the mouth.
Yeah.
And I remember my Professor A.B. Srivastava at BHU, he used to say that mouth is the mirror of the body. If you look into the mouth, we didn't have that expertise, but that generation used to have. You open the mouth and he will come up, get few blood tests done. I think you are deficient in iron, you're deficient in B complex. I think you need to get your calcium checked. I'm not. I'm thinking that well, I presume that you have XYZ thing happening just by looking
Look at
into
the
the
mouth.
mouth. Just by looking into the mouth, because the mouth is a very is the entry point of your body,
Yes.
and it is so beautifully designed. Every aspect has its own effect, and it's so vascular that most of the, for example, blood sugar, diabetes, many times the diabetes in a person uh, has been diagnosed because dentist observing something and telling ki madam just get your blood sugar checked. Your gums, your tongue, your cheek, the color, the dryness, the
Really?
viscosity of saliva, everything is so important that many times many diseases in the body depict first in the mouth, and then
Wow.
it is diagnosed. So obviously mouth is a amazing
The entry
structure.
point, yeah.
And I remember in earlier days, though, whenever we used to go to the doctor, he used to start with your eyes and this, and then he used to tell you open the mouth and and do this. Though because of the new advent of various diagnostic aids, all these techniques are going. But yes, mouth is the mirror of the body, and most of the thing what is happening in person's life or health is depicted in the mouth.
So you were able to see a lot of things.
I am able to see few things, and one thing I've seen is that your mouth is so much very important for your gut. It is so much very important for your fitness. Not only the physical fitness, it also is so very important for your self-esteem. If you are able to eat well, if you are able to smile well, if you have got a good odor in your mouth, and if your teeth are healthy, most of the dental diseases are gone, madam. And I have seen a very particular correlation between the oral health and the mental status of a person, ma'am. During the phase of stress, during the phase of depressions, during the phase of various physiological phenomena going into the body,
Which is really happening a lot these days.
a lot happening these days.
Yeah.
Your mouth tells it. The trick lies in reading it. If you are able to read it, many things I have personally observed it going down. Rather, I would also like to quote Dr. Sandesh Maikar. He is a very famous doctor and dentist in uh, Bombay. He has written a book, Mouthful, where he starts his book with a story where a person came to his clinic and he said, "Ki doctor, I just don't want to live anymore. I just want to a good rich person, I having no issues, but I don't want to live anymore. This is the end of it. And he was so down. And he observed that there are few occlusal corrections which are required. And he made some occlusal splints for him. And then within a week's time, most of those feelings which the person was having has gone. So we also see during
Wow.
stress you clench your teeth. You during
Yes.
stress you have got xerostomia, that is dryness of the mouth, due to which the bacterial activity increases, because saliva has got immunoglobulin A, which is protective in nature, which goes down, and then it starts to form a cascade of various illnesses happening. So many times all these things are depicted within the mouth. The mouth does not only have the teeth, it has got the tongue, it has got the
Yes.
palate, it has got the
Yes.
saliva. The your digestion in the gut starts from the mouth here.
Yeah, so the
Starts from the mouth.
first step starts from the mouth only. That's why they say to eat slow, chew slowly
Yeah.
and bite it.
There is a in our Vedas it is written that you need to chew the food 32 times. And when you chew it, I remember once I did a Art of Living course by Sri Ravi Shankar ji's teacher,
Hanji.
one of the guy teacher from that group, and one of the exercises which they gave is ki you put an elaichi in your mouth,
Okay.
and then you keep the elaichi in your mouth for 10 minutes. So what you have to do for those 10 minutes, you are feeling it with your tongue, you are rolling it, you are finding that outer layer which is fibrous coming down, small seeds
Seeds.
coming out, they also moving all around in your mouth. So it was a fantastic meditation. So it was just slow down, just slow down. And if you, I sometimes ask people, how many minutes in a day do you spend in chewing your food? Hardly, because everything is cooked, everything is soft,
Yeah.
everything you have gulped in, and even if it is little hard, you don't have time to have it. Breakfast is done running. Most of the time, I've seen people doing the breakfast in the car or wherever they get time. They just put one or two bigger
Bites in the mouth.
bites in the mouth, and this it's over. Lunch is working lunch. We have been taught that you should not speak when you are talking. You should
When
not
you're
speak when
eating.
you're eating.
Yeah.
Nowadays, we have lunch meetings where you keep
Talking.
on talking and eating less. You're not eating there also. And then the dinner time, you're too tired to have a dinner because you have next day in your mind. You want to go and sleep. So it's very little time we are spending on our
Chewing.
chewing. That is again responsible for the gut health. It is also responsible for your oral health, because every time you're eating anything fibrous,
Yeah.
anytime you're eating chewing something for longer time, you are unknowingly brushing your teeth. So instead of having a soup, instead of having a juice of vegetable soup, you just chew the food, you chew the vegetables. Every time you're chewing it, you are, it's something like I give a simile, आप दातुन कर रहे हैं.
Hanji.
नातुन में भी तो ये करते हैं अपन, कुछ फाइब्रस एक स्टिक है जिसको चबाते जा रहे हैं. तो चबाने से क्या हो रहा है, इट इज कन्वर्टिंग इनटू अ ब्रश which is cleaning the teeth. चबाने से क्या हो रहा है, your saliva is increasing. So that is again very much responsible for the digestion of the
Yes,
food
of
and your
course.
gut health.
Of course.
So all these things are not happening. So you are chewing less, the saliva is less, so you are gulping it up with water or drink or whatever is there for you to do it. So chewing is very important, and whenever you use your teeth, you chew your teeth, you increase the muscle capacity of your mastication. Plus, you are unknowingly brushing your teeth. You are massaging the gums unknowingly with the fibrous food and all. So chewing is very important, and you need to chew 32 times. I find it to be little too much.
It's like
But
not excessive.
still, take a small morsel, keep chewing, spend some time, become aware of it, smell it, taste it,
Enjoy the food.
feel
Different
your, yeah.
textures.
And if you can go to another extent, feel it going down into your esophagus, going down into your stomach. You can just appreciate, because as again I quote Sadhguru, he always just say, see, it is so amazing. Whatever you're eating is becoming you. It is so true. This is a glass of water. This is water, but I drink it. It becomes either my blood or it goes into my system. It becomes part of me. So at least respect it, smile it. Again, there is another Japanese uh, Japanese experiment in which what they've done is a glass of water.
Yeah.
You say you just hold the water for few seconds, appreciate it, and thank the water, and then you drink. Second thing is you just do it anything, or third thing you just don't care for it. And then they saw the microscopically how does the water molecules behave once your thoughts go there, and they find there is a lot of change, there is a lot of symmetry and beautification whenever you appreciate.
No, a friend of mine who's into teaching a lot of things about mental health actually said कि wherever there is an argument happening, and sometimes arguments or fights happen at home, don't have water from that place, because
Ah,
water is one thing which
yeah,
will
yeah,
kind of imbibe
yeah,
all
yeah.
that negative energy, or water imbibes the energy, positive or negative. The negative energy, it will imbibe in that fight, and if you have that, you will also carry those emotions and
Yeah,
feelings. So
yeah,
I
yeah.
think if water can, food can absorb, I think, a lot
See,
more.
recently Kumbh happened.
हाँ जी.
What is the concept of Kumbh? Why everybody wants to go and have a dip and come out of it? Start from where the water is coming. The water is coming from Himalayas.
Himalayas.
What is happening in the Himalayas? Who is living in the Himalayas? Various sages are living in the Himalayas. What they're doing, they're dipping in there every day. So what are they doing? Their energy is being transmitted to that water. That is a huge, huge, huge energy. It is
Yes.
coming down, coming down. When it touches you, some of it goes into you also. So water as a liquid is something I call it very emotional, very sensitive, and just for a second, for a minute, think this water in this glass, what it has gone through to reach
To
here.
reach here.
River, and then the boosters, and then going rushing into the pipes, and then filtering, and then going here, going there, storing into the tank, and then pushing it up over there, and then coming to your RO system, and then it comes onto your glass.
Wow.
Sometimes at least give a little respect. I'm so thankful to you, you're here with me.
We never thought of it like that. Do you know the process where you never thought about, the
Ah,
glass of water that you're having has.
so it has, madam. Everything you eat, everything you this is directly related to the fitness and directly related to the. Even somebody was telling me, don't, as you said, ki don't, where there is an argument, don't drink the water.
Yeah.
They have seen, even if something very filthy is given to you, but I read it somewhere, I do not believe, but if you just eat it very lovingly, very passionately, the chances of it getting affecting you is less.
वो कहते हैं ना, आपने वो सुना ही होगा, शबरी के बेर वो मतलब खुद टेस्ट कर रही थी वो खट्टा है या मीठा है, तब राम जी को दे रही थी, इन द सेंस झूठा वो उनको दे रही थी, but because it was given with so much of love and
Love.
care for her God, that he didn't mind it. So it's like और वो एक और चीज कहते हैं ना कि गुरुद्वारे में क्यों हलवा का जो प्रसाद है, इट टेस्ट समथिंग एल्स, जबकि वही रेसिपी है जो हम घर में बनाते हैं, गुरुद्वारे में हलवे की रेसिपी इज नॉट चेंजिंग, बट वहां जाके वो खाने से इट्स लाइक इट्स अ डिफरेंट फीलिंग, बिकॉज आई थिंक यू पुटिंग लॉट ऑफ इमोशंस एंड लॉट ऑफ good thoughts while making it there in the gurdwara. So food gets that energy also.
घर का खाना क्यों अच्छा लगता है हमेशा? उसके इमोशंस
वो
हैं,
माँ प्यार से बनाती है, वो
प्यार है, इमोशंस है,
इमोशंस है, वो हेल्थ का सोचेगी, वो न्यूट्रिशन का
चीज सब वही
सोचेगी.
है, बट इट इज again, it's all transmission of energy from one thing to another. So it becomes so very important that what goes into your mouth. Somebody quoted yesterday two things. हाँ, some elderly gentleman was there. He said कि जिंदगी में दो चीजों का ध्यान रखना है for your fitness and for your health. क्या आप सोच रहे हैं और क्या आप खा रहे हैं? Don't eat anything which is affecting your mental health. Don't think or read or listen to something which will disturb your mental health. Don't eat anything which you feel will disturb your gut health. So just दो चीजों का ख्याल रखो, क्या मुंह में जा रहा है, क्या दिमाग में जा रहा है.
एक्चुअली ये चीजें रूल कर रही हैं पूरे सिस्टम को, हमारे
पूरे सिस्टम को यही रूल कर रहे हैं. एब्सोल्युटली. एंड उसमें फिर मेरे को लगता है कि एंड व्हेन यू च्यू इट, so you are spending time with whatever is going into your system. So it's something like welcoming. Chewing the food is like welcoming. Okay, fine, you're welcome. So spend some time there, be with the food or the morsel, thanking it or her, or thanking it, the thing which you're eating. So the absorption is better, you feel good.
Wonderful. There are a lot of things that I've really not thought about, but this is so beautiful. This is really nice.
This is there. So
So actually now coming actually to the teeth part, we have been told that we should brush every day. Should the brushing be done like after every meal? And this flossing also that we're talking about, is it like a Western trend or we should do it as पुराना आपने अभी बोला दातुन पहले तो सिर्फ दातुन होता था, now there are so many things available. So what is the right procedure to start taking care of our teeth basically?
So see, madam, most of the, as we just said, ki the mouth is the mirror of the body.
हाँ जी.
So basically, there are so many things happening within the mouth, madam, or there are so many things happening around the teeth. As we have a word outside where we are living, a similar type with a larger population is there inside the mouth, madam. It is basically all the various types of bacteria, all the various types of viruses, all the smaller types of fungi, and they all are in fight with each other to create an ecosystem inside. And again, the one who is stronger
Wins.
will wins.
Yeah.
So usually, whenever the immune system goes down of the body, one or the other bacteria starts to multiply, and then they take over everything, and lot of dental issues. So apart from brushing, apart from your diet, apart from your water intake, there is nothing in our hand, because all these things, the saliva, composition of saliva, flow of saliva, alignment of teeth, structure of teeth, the composition of teeth, it is all determined, it is there.
We
So
were born
now
with it in a way.
you're born with it.
Yes,
है ना? So
yes.
only thing which we can do to help
Yeah.
keeping an oral health good is to brush your teeth. Why do you want to brush your teeth? See what happens that there is a layer which forms onto the teeth, onto which the various bacteria attach themselves. That layer, if remains there for a longer time, it starts to affect the surface of the tooth. So when you brush, you remove that layer from the mouth, and that foam which comes out helps us in removing the decreasing the bacterial population. So when you brush your teeth, that layer is gone, and that layer, as soon as you stop brushing, within few seconds starts to form again.
It forms again
So that's
without even
why,
eating.
if you're not eating, yeah. Rather, if you're eating,
Yeah.
it will form less, because when you're eating, you're disturbing it. Because whenever you're chewing your food, imagine you're chewing your food. These are our teeth. When you're chewing your food, you are moving it like this. Your tongue is also moving here.
Yes.
Your cheek are also moving here. So what you're doing unknowingly, you are cleaning your teeth. So that's why those people who have got a long span of not eating anything, you will find they come and said there is a different type of smell inside the mouth. Or those people who do not brush, because that layer forms on the teeth, which is to be removed every 12 hours. So
Every
that's
12 hours.
every 12 hours, because first it is thin, and then after 12 hours it starts to become little more thicker or little more calcified.
Okay.
So that's why some people who are not brushing, you will find a layer of deposits on the teeth. That layer of deposit is like, there is a glass of water, you start putting salt into it. After some time, the salt starts to settle down, isn't it? It's not that immediately you will find that there is a salt. Hai na?
Yes.
It is because the saliva the water has soaked all that salt which is important. Similarly, in our mouth, some people have got saliva which has got more salts into it. So these salts, they start getting deposited here. The
Saliva has more salt. Some people.
Saliva has got lot of digesting enzymes.
Oh, yes.
And lot of alkaline power within it, madam. So basically, it is alkaline in nature. So that means there are few salt particles within the saliva. So when the salivary flow decreases, the concentration of the saliva increases. Once the concentration increases, it starts to deposit. That's why people who have got viscous saliva,
Yeah.
they have got more tendency to deposits. They are the one who are coming so frequently for cleaning the teeth. The only thing in their hand is to keep brushing every 12 hours. So that's why morning and evening, morning and night, Night brushing is important so that when you sleep, at that time this bacterial population is less. So, this is most important to us. In rural areas in India, we don't find so many dental caries. That's because most of the food nowadays they are also become semi-urban, madam. But earlier there used to be a lot of raw food which they were eating. Their
Yes.
diets and diet in an urban city were different.
Very different.
That's why the dental problems are more in urban population rather than in rural. It's because they when they eat, they are unknowingly brushing their teeth. So it gets cleaned, it gets cleaned, it gets cleaned.
Yeah, I used to wonder कि when we brush at night and sleep, सुबह सुबह उठ के क्यों करना? Apart from getting that mint flavor and that fresh feeling,
सुबह सुबह
but I didn't realize the
हाँ
bacteria is playing the role
हाँ
even while we're sleeping.
इट इज ऑल द टाइम गोइंग प्लस बल्कि क्या होता है कि रात को आपका मुंह का सलाइवेशन भी कम होता है रात को आपके होठों का आपकी जबान का मूवमेंट भी कम होता है
बिल्कुल.
So the bacteria have got lot of free time
Oh.
to start. So that's why you do it at night before sleep. मॉर्निंग में वो कई बार देयर इज अ लिटिल बिट ऑफ सम स्टडीज आर कमिंग कि नहीं आप ब्रेकफास्ट के बाद करिए सम पीपल आर सेइंग कि आप तुम इमेजिन करो एज अपने लोगों में होता है सर्वाइवल ऑफ द फिटेस्ट
हाँ जी.
so the whole night the bacteria has got fight with so many people around so many bacteria the morning bacteria are the fittest so retain them rather
Retain
than
okay.
brushing it so again this is ongoing this is one school of thought they say कि एकदम से सुबह उठ के आप ब्रश ना करें कुछ लोग बोलते हैं कि सुबह उठ करके आप सबसे पहले ऑयल यूज करें
ऑयल पुलिंग जिसे
ऑयल
कहते हैं.
पुलिंग जिसको
हाँ
कहते
जी,
हैं
हाँ जी.
तो ऑयल पुलिंग में भी जब आप करते हैं तो आपने अपने दांतों को कस के बंद किया हुआ है उसमें वही ट्रिक है यूजुअली यू डोंट हैव टू do the oil pull just like this you have to clench your teeth tightly and then you have to swish it so that the oil flows in between the teeth so once it goes in between the teeth it cleans these areas also so the flossing is automatically done by the oil and when you spit it you will find it the whole oil becomes milky white and they say it has become milky white because it has removed all the plaque which was attached onto the tooth structure. Secondly, they say that the gums are richly supplied with blood. So because of some osmosis, there are few toxins from the body which are liberated out, and that's why the whitish color of the. So
Gums.
one of two things are very important in oil pull. So you clench your teeth tightly and then do it, and secondly, not a single drop should go in because it's full of dirt. And spit it after that. Take some lukewarm water and rinse out and you will feel a little difference. And those, when told to the ladies, they say and they that people are that her friends are asking, "What cream are you using on your face?" Because now it is shining. It is shining because you have swished it so well that the vascularity has increased inside the onside the cheek. Hair fall have stopped. But so many people come up with adjunct issues because of the oil pull. Just because mouth is the mirror of the body. How you keep your mouth determines what happens in your body. So this is a fantastic thing. So flossing can be avoided, but so brushing is the only equipment in our hand. So brush twice. And nowadays we have something which we call as a water flosser. Water flosser is also a fantastic thing. It is something like this. You just push the water into this, and when you do this, the water jet comes out from here. So you put it in your mouth like this and on it. So once you do this, all that plaque which is there responsible for most of the dental diseases go away.
So this is better than oil pulling?
This is both are two different things.
Okay.
Use the water oil pulling in the morning. Use the water floss at night.
Okay.
Sometimes teeth become like this, you know.
Yes.
Can I keep it here?
Yes, of course.
You know, this is all because of the not able to clean. So it becomes brown like this. You know? And once it becomes brown, it starts to make cavities inside the teeth, food starts to go inside the teeth, and all those things happen. So oil pull, water flosser, all these things are really good to keep your mouth hygiene good, and brushing twice is important. Just because it is the only thing. I always say brush is koi wo nahi hai. It's not a magic wand. I can.
कैविटीज खाने से नहीं होती हैं, कैविटीज वो बैक्टीरिया क्रिएट करता है व्हेन वी आर नॉट क्लीनिंग देम प्रॉपर्ली।
कैविटीज ऐसी होती है ना, ये कैविटी होगी।
हाँ जी।
क्या रहता है कि अपने मुंह में देयर आर टीथ, देयर इज सलाइवा एंड देयर इज फूड। फूड में भी कौन सा फूड, आप गुड़ खाएंगी आपको कैविटी नहीं होगी।
नहीं होएगी।
हाँ, आप चॉकलेट खाएंगी आपको कैविटी होगी। It's not that the bacteria loves chocolate more than good, but it is bacteria is able to break down. जो गुड़ है, it is a polysaccharide. Polysaccharide are broken very difficultly by the bacteria. Whereas they are polysaccharides, they are monosaccharides. Monosaccharides are easily broken down by the bacteria. तो जहाँ पे भी सलाइवा मिल गया, सलाइवा में बैक्टीरिया, टूथ का स्ट्रक्चर में ये कैल्शियम है मैडम, और जब आपका मोनोसेक्राइड वहां पहुंचा तो बैक्टीरिया स्टार्ट्स टू प्ले ऑन टू इट. सो वंस इट डज इट, it liberates an acid. Now this is calcium. We know that calcium, if you put an acid onto a calcium, the calcium dissolves from there. So 96% is calcium. So imagine it's like a grid. It's like a grid like this, where there are these areas where there is calcium molecules and the rest is all organic tissue. Organic tissue can easily be broken down by the bacteria. So when you take something meetha and then it goes and remains there for long time, and then along with it the bacteria and tooth structure meet. So wherever these three things meet, it starts to liberate acid. That acid starts to dissolve the calcium. So you find that the tooth has become a little black.
Yes.
It is because it has been charred. When you put something, burn something, it just goes away. So once it is charred, it starts to create a hole. So that's why whenever you eat anything sticky and sweet, brush your teeth
immediately,
as early as possible. Because time is also a factor. The bacteria do not, it started to work, but saliva tries to protect it. So time is a factor. Or, for example, in children,
yes,
they take a glass of milk before rushing to the school because they also don't have time for breakfast. So milk is very carcinogenic. So after that, I said give them a sip of water, so that the quantity of milk does not remain attached to the tooth structure. In their tiffin, put 1 or 2 pieces of salad, so that once they finish their food, they eat that 2 pieces of salad. Once they do that, they are doing datun. Isn't it? They are just chewing it. So once they're chewing it, they are removing all that carbohydrate which is stuck to the tooth structure. So that's why the concept of brushing. So in brushing, you remove all those saccharides from there, so that the bacteria have got nothing to nibble on, nothing to produce an acid. So the acid removes this, and then another action we call as a proteolytic action, where it starts to descend down within the tooth. So, and once the cavity forms, you will see, so just open the mouth and see in the mirror, do you have any black spots like this? If you have any black spots like this, that means you're developing cavities. Now, these cavities are only on the surface, so you don't feel anything. Once they go a little bit down, then they come in contact with structures near the nerve. So you start getting little type of discomfort. After meetha, I feel that for a few seconds, I find various different type of sensation. And that sensation goes away as soon as I brush. So that means that the cavity has started. It can be corrected at that stage.
It can
but then people will say, ki, okay, fine, I eat sweet from this side, it hurts. So I stop eating and I start from the other side. It keeps on increasing, madam. And then one day it happens that I take a cold water, ice cream, it hurts. So all these things show that the cavity is going down. So take care of it. Most of the dental problems can be protected, can be avoided, if we have a good hygiene, if we have a proper care of the teeth.
When cavities go down, when they're almost about to touch the nerve, that's when you do the root canal?
Yeah. So what happens, I have something like this. So it is So it is like this is the first phase. You know, this white
I
structure.
think,
uh,
sorry, we can,
I know, so this is a white structure.
yeah,
This is just decay.
yeah,
As long as the cavity is here in the white structure, for example here,
yes,
you will not feel anything. When you go to the dentist and the dentist say, madam, you have got a cavity. No, no, but I am fine, I have no
no
problem.
pain,
No,
nothing
madam,
at all.
but there is a cavity here because there is no nerve supply here.
Okay,
Imagine, madam, so this white portion is the strongest structure in your body. Is the strongest structure in your body. This is
in the
enamel.
body or the
In
teeth?
the body.
In the body.
In the body, the strongest structure is the enamel. This is it.
Okay.
This is the way the body is made. Beautifully. Well, I can see a cosmos in a tooth. They said,
I'm sure.
this is rare. So this is the outermost structure, which is the hardest
Hardest
structure.
in the body.
And imagine a small bacteria is able to dissolve it. Just a small bacteria. So this is a cavity, you will not feel anything. When it comes to this pink color, then your sensitivity to sweet, sensitivity to cold, food lodgement, these three things start. You still ignore, it goes to this red portion.
Yeah.
Then it becomes sensitive to hot. And then
Okay.
as it goes little deeper, an acute pain for which the dental pain is infamous. So this can be filled. This can be filled. When it reaches here, then you need to clean all this area. Now see, this is a portal of entry into your body.
Yes.
Imagine, so protective mechanism we have because we use this to chew. So once this is breached, it goes here. This is the canal here. Once it reaches here, madam, this is an area where we have blood supply. Once it reaches here, this can go anywhere in the body. So that's why they have found that the dental disease, dental infection is related to cardiac ailments, to your heart problems, to your,
Really?
to your in especially for in pregnancies also it affects the pre-birth of the child. Or I usually say that before planning a family, one must get a dental clearance types. See that there is nothing which is going to bother in next year, because 9 months plus 3-4 months in the early stages of
Yes.
this. So this is so very important, that because if it reaches it here, the bacteria can flow anywhere inside the body. It is like this is a port, and once the enemy have reached into this water, these are the canals which can go anywhere in the body. So then we have to do the root canal treatments, and the treatment becomes complex. So look at these signs, which is very much important for the general health, that you're able to, you are not feeling any sensitivity to sweet, cold, food lodgement. These are the three initial signs. Any sign seen, go to the dentist.
So, are, like you said, pregnant women. So, normally, are women more prone to all these problems?
Yeah. Another thing, women are more prone to to dental problems than men. Again, it has to do with the statement I made that your mouth is very rich in blood supply. So during pregnancies, during periods, there are a lot of physiological things happening inside the body. So one feels that there is a little bit of bleeding which has started in the gums, or there is one, especially I see it in the front between the lateral incisor canine, or around the lateral incisor, a little bit of swelling comes, especially during periods. I've seen that it comes and then it goes away. So once in a month it comes, or once in 2-3 months it comes. Sometimes it is all to do with the physiology, because at that time the hormonal levels in the bodies are high. So then after during pregnancies, so obviously the hormonal level is very high.
Very
So
high.
it affects the gums. At that time, if the oral health is not good, so if the oral health is not good, then the chances, see, during pregnancies, if the oral health is not good, there will be more enlargement of the gums, because their gums, the blood supply among the gums increases. So that's why the blood supply increases, after the blood supply increases, if there are tartar, if there is brushing is not being
Done
good,
properly.
if the teeth are dirty, so they act like inducers which causes the inflammation to happen around it. Once it happens, there is bleeding from
Bleeding
the
of the
gums.
gums.
Once the bleeding from the gums start, the person becomes more apprehensive in brushing. So they come
Yes,
onto
it's
finger.
like, yeah,
So once you're doing it, it's a vicious circle.
it
So
is a
once you
vicious
start
circle,
using the
yes.
finger, you cannot clean it with the finger.
Yes.
Even for your utensils in the kitchen, any utensil in which the oil preparation has been done, you need to have a scrubber.
Yes.
You need to have some powder.
Yeah.
Similarly, in the mouth, you need to have a scrubber. That scrubber is in the form of a brush. But as soon as the brush touches it, it bleeds.
Yes.
So they become scared. So they stop brushing in that area. And then it goes on, goes on. So during pregnancy, and then see what is happening. Oral health is not good. Portal of entry are the gums. Bacteria going inside the body. Right? Your immune system has enough capacity to get rid of it.
Yeah.
But in some cases, it is not. It is going into your body. Through placenta, it is going into the child. All those things started to happen.
So it starts
So
affecting the
I'm
child
not
as
trying
well.
to scare,
Yeah.
but see, theoretically it happens. And it has been found, preterm babies with generalized periodontitis, which we call as a very poor oral hygiene, has been seen. Another very interesting thing, when a child is born,
Yeah.
there is no bacteria causing cavities in child's mouth. Child's mouth is sterile. There is no bacteria which can cause caries. The bacteria causing caries in a child's mouth is accidentally transmitted by mother or father. Mostly mother, because during the early phase of the life, the child is closest to the mother.
Mother.
तो जो बचपन का लाड़ प्यार होता है ना, उसमें वो एक्सीडेंटली ट्रांसफर हो जाता है. इस कारण से यदि मदर की डेंटल केरीज की टेंडेंसी बहुत ज़्यादा है, तो ऐसा देखा जाता है कि बच्चों की भी होती है.
होंगी.
तो यदि कोई बच्चा ऐसा आता है जिनकी मैं देखता हूँ कि 5, 7, 10 कैविटीज दिख रही है भाई, तो मैंने बोला कि हाउ आर द टीथ ऑफ योर मदर. तो डॉक्टर, आई हैव अ वेरी पुअर हाइजीन.
तो नॉर्मली हम कहते हैं हेरिडिटरी, इट्स नॉट हेरिडिटरी.
No, इट्स एनवायरमेंटल मैडम. इट्स हेरिडिटिकल में मैं कहूँगा जेनेटिक इन्वॉल्वमेंट कुछ होगा, होता भी होगा.
हाँ जी.
जेनेटिक इन्वॉल्वमेंट इसलिए होता है क्योंकि अगेन सलाइवा प्लेज अ वेरी इंपॉर्टेंट रोल. योर पीएच ऑफ द माउथ प्लेज अ वेरी इंपॉर्टेंट रोल. नाउ वो सलाइवा ऑटोनॉमिक नर्वस सिस्टम से कंट्रोल होता है, वो अपन नहीं कर सकते हैं. तो वो क्या ट्रेट से आ रहा है अपन को पता नहीं. But yes, environmental. Most of our problems are because of the environment we are living in. So this is very interesting. So that's why it's very important that again before planning a family, have a good checkup. If there is few impacted molars lying there, get them out, because during the pregnancy period, the dental treatment are avoided. In few
a lot of things you can't get it done.
Not you can't get it done.
Yeah.
Second trimester is the best period to do any dental treatment. First trimester और third trimester में हम लोग usually avoid करते हैं. In emergency सब कुछ हो सकता है, but second trimester is supposed to be the safest. Before any trimester starts, it is the safest period, तो तब करा देना चाहिए. और if your oral health is good, the pregnancy time goes on easily, and then the tendency for the child to having it is also less. तो कई बार होता है, कभी ऐसे भी कुछ केसेस होते, बहुत सारे देखते हो कि वो थर्ड ट्राइमेस्टर चल रहा है, एंड देयर इज लॉट ऑफ पेन, डॉक्टर आई एम cannot sleep, I cannot take lot of medicines also, because all these medicines they cross the mother child placental barrier, goes into the child, so you can't give them. तो बोलता हूँ, see, this is start of motherhood. This is how you start. Now the whole another 20, 30, 40 years, this is motherhood.
This is motherhood.
See, you are suffering because you can't take the medicine, because you are protecting your child.
Yeah.
So that's very philosophical about it. So get your oral health done, brush twice, floss. Control of diet is also very important.
Very important.
Not only for gut health, madam, it is also very important for oral health. Have as much fibrous things as possible. Another thing is the citrus fruits.
Yes.
Especially citrus fruits increases the pH of the mouth.
Okay.
Make the mouth little more acidic. And it is all calcium around. So there is erosion of calcium. Whenever you take, for example, some people have a tendency to take Nibu Pani every day.
हाँ जी,
Every day by default, doctor, I have to take Nibu Pani. It is so very important.
I know.
It's not, again, it's not a Rampant. You can take Nibu in various other ways. But imagine early in the morning you wake up. First thing you do is put a glass full of acid into your mouth. It's a good citric
lot of
acid.
people who are exercising in the morning actually have hot water में नींबू डाल के
नींबू, हाँ, तो वो ना उसमें फिर कहता हूँ करने के बाद आप एक आधा ग्लास नॉर्मल पानी पी लीजिए, नॉर्मल गर्म पानी पी लीजिए आधा, so that the pH of your mouth should not remain acidic for a long time.
Okay.
If it remains acidic, it will erode the enamel. With aerated drinks, so madam, it is so much. I remember a boy going to US for studies. He came before going. After a year, he came back for a checkup. And I found there is so much erosion on his teeth. And I asked him, what is this? What are you doing there? What are you eating? What are you drinking? So he said, sir, I am at a place where the aerated drink in my college is free. So instead of drinking water, I drink aerated drinks 3 or 4 times in a day.
Oh my God.
So what it did, aerated drinks are full of acids. This is again calcium. So just eroded the enamel. And then the teeth become so sensitive that even if you try to inhale, ऐसा भी करते हैं तो लगता है बाप रे कितना अजीब सा लग रहा है. So aerated drinks, acidity, apple cider. There are so many people. No, it is so good. It is.
I know that's it. They're saying to have it.
It's very important. It's very important. I can understand.
फिर
But
उसके
for
बाद
my
गर्म पानी
teeth,
पी लो.
मतलब wash off your mouth.
Wash off your mouth. That's important.
For children also, I think taking out chocolate from a child's life is taking out half of his childhood.
I know. This
Isn't it? So you
makes
take
also help.
chocolate, you take chocolate, but you brush after it. So I say you keep, if you have, I go to an extreme, I say if you have a brush in your pocket, put the chocolate in your mouth. If you don't have it in your pocket, put the chocolate in your pocket. Come back home, eat, brush your teeth.
Oh, that's a good one. That's a good one. They're
So,
good.
so that these are small things which make it, and then keeping that salad piece in a tiffin, in a child's tiffin, so that he can eat it after it, so that anything sweet which he has taken has been cleared off, because he can't brush in the school.
How about chewing gum?
Chewing gum is fantastic.
It's fantastic.
Yeah. There's no problem. It solves so many purposes. Sugar-free chewing gums. Sugar-free.
Sugar-free, not the sugar ones.
Sugar-free. So when you chew it,
Yeah.
you increase your saliva. You know, whenever you are chewing something, you automatically the saliva goes in. Saliva is full of digestive enzymes and immunoglobulin A, as I said. Second thing is it picks up all those small particles which are attached onto the tooth structure. So chew gum for 15-20 minutes and then throw it away. It's good. Chewing gum is good for health,
Good for health.
oral health.
So we've spoken about kids, but what about elderly people? Because unfortunately, एक stage आती है when your teeth are actually all giving way. जब आपको dentures की जरूरत पड़ती है, like both my parents in the same situation. My mother completely उनके तो ऊपर नीचे दोनों के dentures हैं. One, how can we not reach that stage? How can we maintain our teeth? And secondly, if we reach that stage, तो भी क्या करना चाहिए? मतलब we have to eat, we have to live our life. तो उसके लिए dentures is a solution, yes. But how do we go about it?
Now see, earlier dentistry used to be fillet or extracted. There are only two things which we used to do when around 40 years back. Most of the dentistry was you fill a tooth or you remove the tooth and make a denture, make an artificial denture. Over the period of time, the removal of the tooth has become less. It is because the various treatment modalities like people awareness, people are becoming more aware.
Yes.
Availability of dentists have become more available. Earlier it used to be 1 or 2 dentists in the whole city, so it was there. Third thing is concept of health, which is coming, as it can be covered in awareness. Fourth is in dentistry also so many advancements so that you can restore the tooth. There are few places where you need to surrender. You can't restore the tooth if the tooth is too much broken or if the tooth is started to shake because of because of the gums or the bone going down. But it's basically the tooth is a tooth is held. A tooth is held inside the mouth. For example, if I this is a tooth. So tooth is not fused with the bone. Tooth is suspended into a socket inside the bone. So there are various ways in which we can restore the tooth.
Okay, so it's not held by, it's held by the bone.
See, it is. No, I can give a. It's like a. क्या कहते हैं दो पेड़ के बीच में कैसा झूला लगा देते हैं ना उसको स्लिंग कुछ ऐसा
हाँ
होता
जी,
है
हाँ, हाँ,
क्या
हाँ,
है ना
हाँ.
सो द टूथ इज देयर इज बोन all around.
Okay.
It's here. There is bone. There is all these dotted structures is the bone.
Okay.
Inside the bone, there is a socket. So bone forms a socket like this. It's a socket like this here.
All right.
It's a socket here, like this. It's a socket.
Oh.
So in this socket, a tooth is suspended with ligaments.
Okay.
That's why whenever you eat something which is hard, how do you come to know it is hard? As soon as you put it there, ये तो बहुत बहुत बहुत
बहुत सख्त है.
बहुत सख्त है.
हाँ.
कैसे पता चलता है? क्योंकि वो जो लिगामेंट्स है वो प्रेस होते हैं. टूथ पूरे का पूरा सॉकेट के अंदर ऐसे प्रेस होता है. प्रेस होता है तो वो लिगामेंट सिग्नल देते हैं, अरे बाबा ये तो बहुत ही भारी है.
It's there is movement in teeth.
Always.
I thought they are like really static.
No. They are. So see, there is, we call it as a physiological mobility. All the teeth move. Why does it happen that people say that, doctor, when I was young, my teeth were so beautiful, everybody used to praise, but now I find that this tooth has come down, this tooth has come down here. I have found that now I am creating little more gaps in between my teeth. Why does it happen? Because tooth is suspended there, tooth is there. On the tooth, there is lip here. So the pressure of the lip is there. On the tooth, whenever I'm talking, the pressure of the tongue is there. And the lower teeth is all the time hitting
being
onto
pressed
it.
by the upper teeth.
So the tooth wants to be in a state where there is not much of pressure. As it happens in our lives, we don't want any stress. No, don't go anywhere. I'm happy here. So the tooth also adjusts itself so that the pressure becomes less. So so the gap comes in between the teeth.
It seems like tooth is a living creature.
It is. It is. For me, tooth is a living creature. It behaves. It speaks. Medically, as a doctor, you need. I say in my lectures, you need to understand the language in which the tooth speaks. The tooth is in agony. It is telling you, but it cannot speak in the words in which we are talking. It can only give signs, signals. The patient will tell you in various forms. So you must understand the intensity with which the pain is asking the human body to tell the doctor, see, these things are happening, kindly help me. So similarly, the tooth is an identity like this, and tooth is suspended ligaments. That's why, imagine one more thing. You were 6-year-old when the first tooth came in your mouth, permanent tooth. Now at this end of at this age also, whenever the two teeth meet together, they meet each other, isn't it? This is the first tooth which comes in the mouth, the first molar. Even after so many years of wear and tear, you have been using it for so many years, eating everything and everything, it is getting rubbed like this. But still, whenever we close our mouth, it touches each other. How is it possible? Because passively it is keep growing. As you keep on grinding it, it keeps going up, going up, going up. That's why people say that, doctor, my gums are going down. It appears as if, there is a cut which I can feel between the tooth and the gum. Over here, many times people come and tell that there is a little bit of space which is coming here. This space is not coming here. The gum is not going down. It is the tooth which is slowly, slowly moving at, so that even at the age of 80, if you are closing your jaws, it is meeting each other and grinding. Anything you grind, it becomes small. No?
Yeah.
And you see the tooth structure is so much grinded, but still it is meeting each other. Why? Because passively it keeps on growing throughout the life. I have one more model to show. Imagine this. This is what happens. For example, a tooth is out. A tooth has been removed. Right? So people say, okay, fine, one tooth has gone, so what?
Yeah.
So this is what happens. See what has happened to the upper tooth. In this case, see the upper tooth. This upper tooth has come down as compared to the rest of the teeth. Can you see this?
Yes.
I know this has come down. Why it has come down? Because it is in search of its antagonist tooth. It is in search
Acha.
of the tooth which is below it.
Below it. So that's the reason it's coming
So it
down.
keeps on growing, keeps on growing. So what happens when it keeps on growing? It creates a gap here. It creates a gap here. So the food starts to get in here. So it starts to decay the tooth, because any place where the food remains, as we talked, it will start to form the cavities. It start to form the caries. So that's why it becomes so very important that we have a complete set of teeth like
That's
this.
where you put the implants there.
That's when you need to replace it.
Replace it.
So once you replace it, you have got dentures, you have got bridges, you have got implants, so many things to happen. For example, here I have one more model with me. This is one way to replace. Here, a gentleman lost all his front teeth, like this. So you see, there are no teeth here.
Yeah.
And these are front teeth.
Yes.
His child is getting married in November at Goa, so he was totally out of his mind. What has happened to my teeth now?
Okay.
So what we do is you take the support of adjoining two teeth and you make something like this and fix it. This is a bridge.
This is a bridge.
Right. Yeah. This we can do because we had a supporting structure on the two surfaces,
either sides, yes.
on the either sides. But in this case, there was no tooth behind. There was nothing to support it, nothing to hold it. So then what you do is you put something within the bone. It's like pillars. Okay. So on this you support it and you make something like this. This is again a bridge, but this bridge is supported on implants. These are the implants inside the body. So implant is basically a titanium fixture which goes inside the bone.
Oh, and so then they're like drilled inside?
It's all drilled inside. And then on that you take the support of it, and then you create something like this which is fixed. A person doesn't need to remove it. This is an implant. An implant is like this. This is the big model of an implant. Wow. So out of these implants, I also have a smaller model. This is the miniature form of this.
This is the actual size.
This is the actual size.
This is the actual size.
This is the actual. These are from 6 millimeters till 13 millimeters. It all depends upon the amount of bone which we have. So these implants are of various sizes.
So when you drill in, what if you drill more?
So for that we do a lot of
the X-rays that you do.
So this is an implant basically.
Yeah.
This is what you see here is a miniature form of
yes,
it.
Yes, right? Understood. Yeah.
So this is an implant. So this that is a total protocol. You follow it. You know it. What you're doing. You know your all structures are very fine away. You see so many factors here. Once everything is okay, then you proceed with this treatment. But it is very commonly done now.
Yes.
So this goes inside like this, and then we close it and let it remain there for 3 months.
Okay, as it is.
As it is. So this is made up of titanium. Okay. And imagine, again, beauty of it, an inorganic compound touches an organic tissue, and the organic tissue starts to multiply. We hear now how does the life came into this planet?
Yes.
There might be some inorganic reaction which created something, and then a cell started to form. Similarly, this tissue, where it comes in contact with the bone starts to form, and it starts to fill all this area.
Wow.
So in 3 months of time, it becomes
firm. It'll become part of
it. Yeah, it fuses. Then you put something like this on the top of it. And there is a bigger screw like this. So this position is this position.
What we'll see is probably that just a little bit.
Yeah, what you're seeing here, you're seeing this.
Wow.
So it is this. And then there is a bigger screw on the top of it. That you just do it, and then over it you give a crown like this, what we say. This goes over it.
So is it because of these things being what they are, like titanium you were saying, and all those things that you're saying, that they become very expensive for people to afford?
See, expensive of implant is basically, I think it will come down. It is more because of some I think, madam, a lot of research has gone into this. Lot of research.
I'm
So
sure.
basically, there was lot of behind the work must have been done. A lot of amount invested, and then still clinical research going on, which makes implant there, the cost of implant. Second thing is, I think the skill of the doctor. When the doctor has to learn all these things, he has to go through various
I'm
courses, go
sure.
here,
I'm
go there.
sure.
Plus, then the
So it is just
equipment.
not the cost of that material. It's like so
Oh,
much
it's
of
not.
things that
Yeah,
have gone
yeah.
into
And
it.
then the equipment, the equipment, the bone materials. So all these things come at. So and then obviously, I think, and might be that whatever you earn out of this doing the implants, you further invest in yourself to learn
Learn more.
more. So I think that's
It's a
why.
never-ending process
It's a
for
never-ending
a
thing for a
doctor.
doctor. So that's why sometimes the rates, the expensiveness goes up, more to do with the skill of the doctor, the amount of the efforts he has placed in, then the obviously the implants. But yeah, over the period, because as it is flowing in so
The
frequently,
normal
so even
things in it.
in India also they have started coming up. DRDO has come up with an implant system. There are various Indian universities which are working on implant systems. Most of the implant systems which we are using are all coming from abroad at present because of
So therefore
so many
increasing the cost
regulations.
also. Yeah.
But yeah, over the period in BHU also, way back in '96, Professor BP Singh sir and his team, they created an implant, and then they did a trial. But then I don't know what happened after that. But as such, material of the implant is not too expensive, but there are all these factors which come out. It's titanium only. Yeah, it's not a very expensive material. But I think the cost of it is because of all these factors,
Of course, of
the
course.
skills and the amount of effort, the
The
research which
education the
has gone
doctor
to the
keeps on
education.
doing all
Yeah,
the
yeah,
time.
yeah, yeah.
Yeah.
Plus the equipment and the inventory of a doctor has to maintain to do such cases. Then follow-ups, the amount of time he's spending. So all these things amount to it. But yes, it's an excellent treatment option. And having teeth like this in the front, so it increases the self-esteem of the person. Imagine his
Of
son is
course.
getting married and then he is walking like this all the time, keeping his mouth closed. All his Instagram photographs are without any laughs. They are all very shy smiles.
Yeah.
So you have changed it. So now, and if
You
it
feel more
comes,
confident. You feel
yeah, you
more
feel
confident.
confident, you laugh a lot. And if you find, if you yourself feel that teeth are looking good, you will show them more often.
Yeah.
I sometimes, when I see people like this, I tell them, they ask me, doctor, any further instructions? Well, yeah, see this material what I put in, it needs lot of light and air.
Okay.
So you must expose it to light and air as much as possible. So what you do if you want to expose your teeth to
You
light and air?
smile.
You smile, you laugh, and that brings in.
That's well put.
That's
That's very well put.
so.
Asking a very common question, there are a lot of toothbrushes available. There are
Uh,
some soft, there are some hard, there are some
uh,
harder ones
uh,
also. There are a lot of toothpaste that are available,
uh,
also
uh,
different variety.
uh,
Different apart from different companies. Even in one
uh,
company, they have many options.
uh,
How does one know this is the right one for me?
uh. Okay. So I always say it's very much, there's a lot of confusion outside about which type of brush and everything. So your brush has to be very soft.
It has to be soft.
सी क्या रहता है ना कि अपन लोगों को साइकोलॉजिकली ऐसा है कि जब तक अच्छे से मांझ ना लो तब तक साफ नहीं होता. Isn't it?
सही
मतलब
बात
it is there.
है. Like
नहीं,
very
ये
hard
तो
on a
छोड़िए,
teeth.
it starts with the kitchen. मतलब I remember when my maid comes, my first thing my father tells her, हाथ साबुन से धो लेना. बोलती है हाँ. भाई साबुन कम लगाती हो, तुम अच्छे से लगाओ साबुन, अच्छे से मांजो, अच्छे से मांजो, अच्छे से मांजो. तो वो जब तक मांजो नहीं तब तक साफ नहीं होता. तो वो एक दिमाग में बैठ गया कि वो, if you want to clean something you have to rub it 100 times.
Yeah.
So similarly when it comes to the teeth, they think that you need to brush अच्छे से. So for that brush you need to have a hard brush. In soft brush you don't get you don't feel as if you have cleaned your teeth, right? But hard brush is meant for dentures, man. Hard brush is to be used to clean the dentures.
Not,
Dentures, these artificial teeth like this.
yeah,
When you have to clean these, you need hard
hard
brush.
brush.
For teeth, no, you don't need hard brush. Another thing which I usually tell, कि for teeth you don't need to have a grip of पहले वो डंडा मार करके कपड़े धोया करते थे तो वो ऐसे ही बैट जैसा पकड़ते थे उसको. You need to hold it like a pencil, because when you hold a brush like a pencil, the pressure on the teeth will always be less. And when you hold it, there's a small rhyme which is given by Indian Dental Association when we go to children school. We go to school to teach the children brushing.
Yeah.
It is round and round, up and down. So you do round and round, up and down.
And not like a straight thing.
Don't do it straight. It is because the teeth are like this. It's like four fingers. You clean it like this, you will see that your brush will touch only the most convex part of the teeth of the finger.
Yeah.
If it is like this, and if I do like this, it will only touch here.
Yes.
This will go unclean. This will go unclean.
Yeah.
But if I move it like this,
In a circular way.
and so it will clean all the circle. Plus, all the teeth, the striations are all vertical. If there is a wall with the stripes, if you want to clean it, you can't clean it like this. You have to go along the stripes. Similarly, when you do it, go it up and down, round and round, and count 10 times. 10 strokes clockwise, 10 strokes counterclockwise. That is enough.
Oh.
So it should not
Clockwise
take more
and anti-clockwise
yeah.
is there.
So you should not take more. One should not take more than 90 seconds to clean the teeth. It's not that कि ये तो 5 मिनट लगते हैं साहब. आप तो देखिए वो सब तैयार हो जाते हैं तब भी पता चलता है इनका ब्रश अभी तक चल ही रहा है, क्योंकि वो 15 मिनट तक जब तक ब्रश नहीं करते उनको वो लगता ही नहीं है कि कुछ दांत साफ हुए हैं. But people take pride, madam. They come and say, doctor, I take 15 minutes to brush my teeth. सब लोग का नहाना धोना हो जाता है और तब भी मेरा ब्रश चलता रहता है. So मैंने बोला आप करते क्या हैं? I just keep it, I place it, and then he is holding the brush. Nobody can do it for 15 minutes, man. He is holding the brush.
वो दांतों की साइड पे रखा हुआ है.
वो आदत वही. तो इसलिए up and down, round and round, clockwise, anti-clockwise, 3 teeth at a time. And then for the front, bring them together, clockwise 10 times, counterclockwise 10 times, up and down, round and round. Then this is one area. It is to be brushed like this. This is to be brushed like this, again with the pressure in which you are holding it a pencil, just like a pencil, so that it is the your fingers.
When I hold it from right at the, like इधर से brush पकड़ के brush करते हैं.
So
गलत है.
when you're holding this, it's your forearm which is working.
Yeah.
I want your fingers to work. So when your fingers to work,
it becomes softer.
Yeah.
I was just holding it, becomes you feel like you're holding it very softly.
It becomes like this, and you just do it 10 times, and then this is one area where we forget to brush all the time. सामने के दांत चपकाने में लगे रहते हैं, पीछे के तो वो ठीक है जैसा भी है, isn't it? दिखने वाले साफ होने चाहिए, ऐसा भी कॉन्सेप्ट आता है. तो this is to be brushed like this. On the top, this is to be brushed like this. इसको people do all the type of gimmicks. They do like this, they do like, but no, just gently, elegantly, just do it like this. And most important thing is, whenever you're rinsing your jaws, clench your jaws as if you're doing oil pull.
Okay.
So usually
hold the water inside.
Hold the water in, clench your jaws, and then swish, so that the water flows in between the teeth. ऐसा हो जाता है पहले, है ना, पानी ऐसे चला जाता है, इतना मुंह खुला रहता है, पानी ऐसे चला जाता है. मैं कहता हूँ आप उसको कस के दबा करके रखिए, जिससे कि पानी जो है वो दांतों के बीच में से निकले. So that is unknowingly you're flossing your teeth as well. So brush, soft brush, and change the brush every 3 months.
Every 3 months.
3 months, 4 months. Check it. You hold it like this and see. If you find it is flexible, then use it. Because with some people I have seen the bristles become small. As it becomes small, it will become hard. One.
Okay.
Second thing, if the brushing is faulty, you will find that it is not horizontal like this. It has become angulated like this.
Got it.
It all depends upon the way you are
brushing it.
So 3 months every time change. 3-4 months change.
What about toothpaste? What toothpaste?
Any toothpaste. Any toothpaste of your liking is good. You may not use toothpaste also. It is the brush which is most important, but toothpaste acts like a lubricant. Toothpaste give you a feeling of mint, as जैसा आपने बोला कि अभी शुरू में कि वो mint की feeling आ जाती है तो अच्छा लगता है. Otherwise, any toothpaste of your liking, keep changing.
And keep changing. Don't use the same one.
Keep changing. Keep changing till you discover your taste.
Not technically, it's not required to change.
Technically, it's okay, madam. If you, I know people who are stuck to one brand for 15 years. They're very happy. Now, if you change their toothpaste, they will start getting jittery about what is happening in my mouth. Continue whatever you're liking. Boring, it's a very boring exercise, brushing your teeth. So make it interesting. So if you have various flavors, you can make it interesting.
I
Yeah,
know.
something like this, or brush. So that's why for younger generation, they have battery operated brushes.
I know these are battery
So
operated
use
brushes
them,
also there.
battery operated, but the clinical efficiency is the same. But yes, if gadgets make you feel better and make you feel like
Like
cleaning your
doing
teeth,
it,
do it.
yeah.
Yeah, do it. Brushing is okay. Yeah.
What about tongue cleaners? How important are they?
Tongue cleaning is Indian concept only.
It's only Indian
हाँ,
con.
it's an Indian concept. ये अपने वेदों में लिखा है. In books there is nothing like a tongue cleaning.
Okay.
But yes, you can use the same brush to clean your tongue also if you want.
But they use that
I
something like a
BG हाँ GB बोलते हैं.
हाँ.
It's all plastic, silver, anything metal in which they clean it. It's okay, madam. If one see, it is again written in the Vedas only. मतलब उसमें अपने Indian text में लिखा है, संगीतास में लिखा है. It's okay. मतलब I think I don't know about the concept of tongue cleaning, but yes, I don't find it
necessary to be done.
no, I don't find it wrong also. It's okay. Anything which is cleaning is okay, madam. So if somebody is doing it or somebody can do it, do it. But it's not going to harm it. It will do something good only, provided you don't hurt your tongue, because tongue is like a sponge, man. If you see a tongue under a microscope, there are thousands of. It's like a. At home we have. Oh no, sometimes you see a green an artificial grass type of a carpet.
Yes,
if you
yes,
see
of
it, you know,
course.
there are these things and then there are spaces in between.
Yes.
Similarly, it is tongue. Tongue has got thousands and thousands of filiform, fungiform areas into it. These are like small bulbs. These are responsible for your taste buds. You know, खट्टा लग रहा है, मिर्ची लग रही है, नमकीन लग रहा है. All this come from the tongue. So that is their function. Plus, it is always soft. So it helps you in whenever you eat. Imagine you're eating hard, and all of a sudden there is a small piece of thread also comes in. Your tongue finds it because there are various pressure points in the tongue to check what is going inside the throat or into your gut. So that's why sometimes it is logical that there might be some stains, some bacterial or fungal populations in those gaps which is there in artificial grass carpets. So if you're cleaning it, it's okay.
It's okay. But nothing that scientifically or as
हाँ,
per
if you're liking it, do it. मतलब इसको मेरे को लगता है कि वो यदि रिवाज है तो है, कर लीजिए उसको. मतलब सोचिए मत. हाँ, और दिमाग में आया है तो कर लीजिए, रुकिए मत. हाँ, क्या फर्क पड़ रहा है अपन को शायद पता नहीं
है. अच्छा, if we have no issues in the teeth, मतलब सब कुछ ठीक चल रहा है, how frequent would you say that you go and visit your dentist?
See, as I told you that, see, this is the first step.
वो इस स्टेप तक तुम शायद पहुंच जाएंगे, आप नहीं पहुंचेंगे, सेकंड स्टेप पे पहुंचेंगे.
हाँ, सेकंड स्टेप पे पहुंचेंगे. आप पहुंचेंगे तब जब आपको सेंसेशन
आएगी. तो
क्योंकि ये जो आउटर मोस्ट लेयर है, यहाँ पे कोई नर्व एंडिंग्स रखी नहीं है. इमेजिन करिए आपके दांत के आउटर सरफेस पे नर्व एंडिंग्स होती, तो आप कुछ भी खाएंगे तो चुभेगा आपको, कुछ भी होगा तो फील होगा, क्योंकि उसमें इसलिए उसको ऐसा बनाया है. इट्स लाइक अवर सोल ऑफ द फुट. It is not as soft as our lips.
Absolutely.
Because it has to go to a hard surfaces, sticky surfaces, it's roughened up. So similarly, it is like this here on the tooth structure. So this can be detected by the dentist.
So कितनी frequent visits करनी?
Second thing is the deposits.
Okay.
You have no one doesn't have any deposits as such. I'm brushing twice, there is okay. But if there are deposits, they keep on increasing, then they start inflamming the gum, the bleeding, and all those things start. So 6 months they say is a good time for a person to visit a dentist. Again, ये भी थोड़ा सा वेस्टर्न ही कॉन्सेप्ट लगता है, वहीं से सीखा है हम लोगों ने. मेरे को पर्सनली ऐसा लगता है, I ask the person to come 6 months. I teach them all the things responsible for keeping an oral hygiene good. My intention of calling him after 6 months is to check if he is doing it right.
Okay.
If I find that he is doing it right, then I say come after a year. Or if you find any of these symptoms happening, after a year if he comes, I I see there are no cavities. I see, are there any deposits? If there are, then I tell them, see, these are the areas you have to focus more. Or I add a gadget in the form of a water flosser or a dental floss, or I look into the dietary habit of the person. If that is also okay, after a year he comes, then I say, okay, once a year, just come. So once a year is okay, but some people I call every 3 months. It is because the amount of deposits they have.
Which they have no control on. Even after brushing, they have no
Even
control.
yeah, so then I say that because you are brushing like this, they are less. Had you not been brushing, it would have been more.
Much more.
And then I find there are reasons why it is happening. Either there is crowding of the teeth are not aligned well. If uh, if it's a plain wall, you can easily clean it. If it's a wall with lot of design, it becomes so difficult to clean those every groove into it.
Yes.
So similarly, when the teeth are little bit of crowding is there, they are not aligned in a proper manner, the person is never able to clean. So for that, sometimes battery operated brushes or come for the cleaning or correct it, align them, so that not for beautification but for functionality, longevity of the teeth, of the gums. So in short, 6 months is a good time, and if after in 6 months time the doctor does not find anything, ask him to come 1 year. I think 6 months concept is basically Western, because I think it is controlled by the insurance companies. I personally feel like that, because then the insurance companies want that every level should be nipped in the bud. So as soon as the small cavity is starting, nip it. Don't let it increase, because then if you increase it, the treatment becomes more complex. रूट कैनाल करिए, पोस्ट करिए, क्राउन करिए, या इतना ज़्यादा हो गया तो इम्प्लांट करिए. So every 6 months they say visit.
They cover it in insurance, all these things?
Yeah.
They do.
That's why they do.
Okay.
So that's why they call every 6 months. You take all the X-rays, everything is going fine, everything is happening fine, good. But if it is not happening like this, and that is a condition also. In 6 months, if you don't go, so the insurance guy can tell you, okay, see, I'm asking you to come after 6 months, you're not coming, you're not taking care. How can I be responsible for covering the insurance?
Absolutely. अभी आपने अलाइनमेंट की बात करी, एक पॉइंट में भूल के आपसे पूछना, व्हाट अबाउट ब्रेसेस? जो व्हेन किड्स आर ग्रोइंग अप, देयर लॉट ऑफ वो नॉट इन अ राइट फ्रेम, जिसे कहते हैं ना, हमारे टीथ हैं आगे पीछे हो रहे होते हैं, तो टू अलाइन देम वी पुट ब्रेसेस ऑन देम. आर दे good to do it? Because I think somewhere the pressure is there on the gums too when you put the braces. Are they good? Aajkal it has become a fashion. There is also the invisible ones which have come now for the adults as well. So is it like a requirement really for good teeth, good eating lifestyle, good life actually, or they're just something like a medical world has created for more sales?
See, alignment of the tooth, why is it important? As we just talked about brushing, if my teeth are aligned well, I will be able to clean them well.
Yes.
Isn't it?
Yeah, the brush should be able to reach everywhere.
Why do you want to keep them clean? You want to keep them clean because of longevity.
Yes.
Because you want to have a good gum support. You want to avoid any type of dental disease to happen. Because where does a cavity happen? As we discussed, cavity happens where there's an area where the food remains for some time. And there is saliva, and there is bacteria, there is tooth structure. So if the alignment is good, even a glass of water can swish off all the food particles embedded here and there. This is the functional reason why braces are good.
Advice, okay.
Second is when the child comes for, or when a child नहीं है, nowadays तो adults are coming more for braces.
Yes, I know.
Because जिंदगी में 40 साल की उम्र तक तो जिंदगी बनाने में निकल जाती है ना. अभी मैं पढ़ रही हूँ, अभी मैं कॉलेज में जाऊंगी, अभी कुछ करती हूँ, अभी नया जॉब लगा है, मेरे को छुट्टी नहीं है, अभी फिर बच्चे छोटे हैं, फिर बच्चे स्कूल चलने शुरू हो गए, कॉलेज चले गए, तो
इन्वेस्टमेंट्स करनी है.
हाँ, फिर उसके बाद वो सोचते हैं कि अब क्या,
अब मुझे अच्छा लगना है,
आई शुड डू समथिंग फॉर माई सेल्फ. तो वो बकेट लिस्ट निकलती है. उसमें एक था कि आई वॉज नेवर हैप्पी विद माई अलाइनमेंट ऑफ माई टीथ, आई शुड डू समथिंग. सो फॉर डैट ब्रेसेस होते थे. तो क्योंकि अब इस उम्र में मैं तार लगा के घूमूंगी, लोग मुझको छेड़ेंगे कि अरे तुम तो 16 साल की बन रही हो, अभी से कैसे थे सब. तो इसलिए वो इनविजिलाइन का कॉन्सेप्ट आया कि ठीक है, ओके फाइन, यू कैन हैव ब्रेसेस व्हिच आर नॉट विजिबल. सो इट केम दैट ओके फाइन, वी कैन डू इनविजिलाइन, एंड दिस अ फैंटास्टिक aligners एक दूसरा word खुल गया. When a child comes for aesthetic reasons, or if a child comes to us for कि I want braces, so the first question is, why do you want braces? My friend had it.
Okay.
So it's a peer group. बहुत important रहता है peer group. Second thing is कि no, I feel. Then when they say कि I feel, then I start to understand the intensity of what their feeling is. Oh, doctor, there's one tooth is just a little bit tilted like this. I want it to be straight because this. So then my next question is, are you on Instagram? So she says, yes, I am. Do you have any photograph in which your teeth are showing? Or every time you are on the Instagram, you automatically close your lips. You understand what is happening?
Yes.
The psychology is happening behind.
Yeah.
I am aware that my this right ear is faulty. So I will always like to sit towards the camera in such a way that my right ear is not in front of the camera. Isn't it psychologically?
Yeah, it happens.
So
yes.
Similarly, when the child is feeling that no, my teeth are not good, automatically I laugh, and during laugh I just close my mouth or I put my hand in front so that people don't show me. These are the people who definitely need braces. Right?
Because you're feeling good is something very important.
Yeah, feeling good is so very important. So feeling good means either it's a peer pressure, or it is your own feeling. I want it.
Yeah.
So when the parents come and say, no, my daughter put some braces, I say it should come from her, because a treatment is a treatment, madam. There is a protocol she has to go through.
Yes.
Don't eat this. My wire is hurting here. This is happening. I'm not liking this. I cannot do this. I cannot do
and
this.
And there are a long process also.
It's a long process. So once it is coming from within us, no, I want it, and I am in my mind. The end result is I will look like this once it is finished. Any small problem coming, no problem. So that's why I always say, and nowadays though the braces orthodontics we call it has gone much advanced. So there is preventive orthodontics, so as to prevent any alignment of the teeth problem happening. Okay. Interceptive. So when a child comes at the age of 7, there are few cases at the age of 7 you say ki, I think your child might need braces when they grow up.
Yeah.
So why? So there are a few things. He's a mouth breather. His nose is blocked, or the nasal septum is deviated, or he's having lot of sinuses. आजकल तो दिल्ली का pollution इतना ज़्यादा है, यहाँ पर तो होता ही है.
Yeah.
Correct it, so that the mouth breathing से हट करके वो nasal breathing पे आए. तो mouth breathing is one of the very important cause for misalignment of the teeth. Whenever you breathe through mouth, your mouth is dry.
Is that the reason we snore also? Or that's something
snoring, yeah, snoring is little different. Snoring, the reason for snoring is different.
Okay.
But it starts with mouth breathing.
It starts with mouth breathing. Okay.
Right. So mouth breathing, so the palate becomes dry. So there is shrinkage of the palate. So the arches become narrow. So the teeth starts to become forward.
Oh.
So you just correct it. Preventively do it. If at the age of 8, 8.5, 9, you find something is happening, so you intercept. It's very too much into it nowadays, madam. You expand the arch at the growing age, so that you don't have to remove those molar, premolars. So there are so many things happening nowadays. So for braces, yes, it's a very good treatment option for functionality and aesthetics. If aesthetic is hitting your psychology, do it.
Absolutely.
If it is a minor correction, it can be corrected even without doing braces by different dental procedures. Because every treatment has its pros and cons. Even after the braces, the hygiene is not kept well. I have seen so many dental issues happening, so many caries happening, erosions happening on the teeth, the gums becoming bleeding happens. So many things happen. So consider the potential, the need for the treatment, and then proceed. So discuss it with the dentist. He will be able to guide.
Then I think all the 7 years, if you're talking about, that means the regular visit to dentist should start at a much earlier age.
But the first visit to a dentist should ideally be at the age of 3.
Oh.
Because at the age of 3, all the milk teeth are there.
Okay.
From 3 years to 7 years to 6 years, all those milk teeth will remain. 6 years onwards, the milk teeth start to fall and permanent start to come.
Yes.
Most important thing is at the age of 3, if there is no dental problem, that is the best time to come to a dentist. The best time to bring the child to a dentist is when the child has no dental problem, because that is what I call as introduce the dentist to the child. Because at that time the dental clinic is very playful place. There are so many small buttons. If you press it, the water comes. You press it, the light comes. You press it, the
Yes.
chair goes back,
I know.
and child loves it. So so they love it. So they do some act like clapping, and the light opens. So they keep playing with it.
Yeah.
So then next time they would like to come, because for
Yeah.
them it's a playground.
Playground, yeah.
And don't tell the child that, see, we are going to dentist, but you are very strong. Nothing will happen to you. The dentist is very good. He will not remove your tooth. He will not give you injection. You are
just
unknowingly
increasing
scaring
anxiety.
him. You are unknowingly scaring, because
Yeah.
child per se have no fear. It is all induced, and they are very good observers. They read the face of their parents.
Yeah.
The tension on the face of the parents, and realize, boss, kuch gadbad hai."
गड़बड़ होने वाली है.
So this kind of say, just bring them in a playful mood, introduce to the dentist, and even the dentist give them some gift, some balloon or something, and then just peep into the mouth, count, check if there is anything required. Even if something is required, 3 years is too small a period. Okay, fine, we'll follow it up in the next visit. First 1 or 2 visits should be just playful.
When my daughter was young, not the dentist but a pediatrician, every visit was one or two sweets being given. So she used to look forward कि वहाँ जाऊंगी तो मेरे को sweet मिलेगा. मतलब something for them to feel happy about going to a doctor also.
Absolutely.
So that's nice. So
recently my daughter is doing her MCH in pediatric surgery.
Okay.
She's at AIMS Nagpur. So she just shared a photograph with us. It is her department, in which there is a poster where there are some animals, monkeys, or this. So there's a small boy.
Okay.
He peels a banana and gives it to the monkey, and the monkey is in the form of a photograph. It's a poster.
Okay.
Poster of a monkey.
All right.
So he just does it, and he's sharing it with the monkey unconsciously. That is the beauty of a child, madam.
I know.
It's so much of emotion, so much of love, so much of lack of fear. I have that, and when I saw it, I said, such a touching picture. Kulti Papa, he is a child, and he has some cognitive disorder. So for that, he was in the department, and so he was sitting, and then he had a banana, and he saw the poster, and then he peeled it and went, and he is just holding it in front of
the photograph.
monkey, yeah. So that is what the child
innocence is.
Innocence, yeah.
That's so beautiful.
And at first 2 visits or 3 visits of a child to a dentist should be peaceful, man. Because the fear of a doctor comes from a pediatrician only. That's why 2 toffees he gave. Because every time we go, there's a vaccination.
No, an injection.
For vaccination, yeah. 2 people are holding this, 2 people are holding this. So psychologically, it is there in their mind.
Yeah.
White coat, doctor means injection. So they are so fearful. But when they come and they realize, no, it is not like this. It's a different word here. And once it happens like this, then for lifelong, they have no dental fear. Otherwise, the fear comes in the first visit, 2 people holding the hand. They vow never to go to a dentist, and then they unknowingly suffer, madam. Because
they avoid going to a dentist
the thing coming
basis.
to a longer stage happens because I am having pain, but I can't go because I am scared.
Because I'm scared, yeah.
तो मैं अकेला उसको सहन करती जा रही हूँ, या दवाई लेकर के कुछ करती जा रही हूँ, but I don't want to go. So इस कारण से go visit a dentist with a child when you have no problem. Another thing I do is when a mother and a child come, so the mother is sitting on the chair, the child is watching like this, and then they are so innocent, they will come and hold the mother's hand because
they're feeling कि mama को कुछ हो रहा है.
So I whisper to the mother or the father, so today at present he is watching you or she is watching you, and you are a hero. You don't have to make any painful face, because then he is reading or she is reading. So I also do the procedures which does not cause any anxiety or pain. एंड देन देखा माँ तो आके बैठी, तुम भी आ जाओ, नहीं मैं नहीं आऊंगा, अच्छा तो अपन गिनते ही कितने टीथ है, सो गिव देम द मिरर प्लेट. So that's very important. So visiting a child, introducing a child to a dentist is
Dentist at an
very
early
important
age.
exercise.
How beautiful. So let's, we have, if we have to wrap up, we have a tradition in our podcast that we play a rapid fire round.
Sure.
And today, let's call it spit it out. Maybe we're talking
Yeah,
about the mouth and the teeth. So there'll be some just 4-5 questions that I'll ask you, whatever comes to your mind.
Yeah.
So let's see. There's no pressure on this. Your guilty pleasure that probably makes your dentist cringe. I'm sure आपका भी dentist होगा. You can't do your own dental treatment. So what is your guilty pleasure that makes your dentist cringe?
Guilty pleasure means?
As in food.
As in?
Food.
Acha, what is my guilt, madam? I think pan masala.
Really?
Yeah. I studied at BHU, madam. It's a Banaras, madam. You can't leave Banaras without eating a pan, basically. So I left it around, once I left 96, I left everything. But yes, at that time when I was there, I was enjoying my pan a lot. And most of the pan vendors around my campus were my friends. Because for a academic reason. When I went to Varanasi, I thought that I will see a lot of oral cancers there because people eating a lot of pan and supari and all those things. So I made few friends who are pan wales, and then I went to their home. I just wanted to know, how do you do it? So there is pan ka patta, there is katha, there is chuna, there is supari. So I saw that he took me to his basement. In his house there was a basement, and the basement was full of pan leaves. मतलब ये क्या हो रहा है, तो बोलते हैं अंधेरे में इसको हम लोग पकाते हैं.
अच्छा.
कुछ होता होगा उनका, कोई मगई कुछ टेस्ट होता के लिए होता होगा. फिर एक बहुत बड़े बड़े कुंड थे, उसके अंदर सुपारी है. करीबन 2 दिन के लिए 3 दिन के लिए सुपारियों को डुबो करके रखते हैं
पानी के अंदर.
तो इन बनारस दे डोंट यूज सुपारी, सूखी सुपारी, दे ऑलवेज यूज गीली सुपारी, एंड दे विल ऑलवेज गिव यू 1 or 2. So if you want to eat it, and they will give you separately. The way the pan is made there and served is very different. And then the katha he was talking about. So katha is basically something which makes the difference. So the way they purify the katha, wash it with milk, for that matter, make it into a proper consistency, and no chemicals used, and then he used to bring it forward. Most of the oral problems, for example, with me, it happened because of the supari, because grinding of the supari, basically. So that due to that, the teeth, they was wearing off of the teeth a little bit, making it sensitive. So Dr. Moni Bhargava is my wife, and she is my dentist. She takes care of my teeth also. So there are a few areas where she has filled it, where she has done something so that the sensitivity stops. So that all happened in those 3 years which I was there. I also remember an anecdote there. I used to hear it that there was some conference of a super speciality in the university. The Maharaja, the king of Varanasi, is the chancellor of BHU.
Okay.
So he was. It was in his mahal that the inauguration was organized.
Okay.
So there were a lot of foreign dignitaries which were also there. So when everybody collected around 9 o'clock, by 9:30 the program has to start. So customary, the water was served, and then a big thal of pan came for everyone, but nobody picked up. So ठीक है, the pan went back. So 9:30 the chancellor was supposed to come, Kashi Naresh. So he didn't come. This is what I heard. So then 9:35, 9:40, 9:50. So the organizers went up कि महाराज जी, आप राजा साहब आपको आना है, आप आ नहीं रहे. बोलते हम नहीं आ रहे हैं. तो बोलते हैं ऐसा क्यों, क्या हो गया सर, आपने हमारा आतिथ्य स्वीकार ही नहीं किया. You have not you have not responded to the welcome of my. आपने हमारा आतिथ्य स्वीकार नहीं किया. तो बोले सर ऐसी क्या गलती हो गई, अपने पान का थाल भेजा था, जो कहते हो वापस आ गया. तो पान का थाल दोबारा आया, सबने पान खाया. तो वो कस्टम है. When you go to anybody's house, they give you water and meetha, and then when you are leaving, they will always offer you pan. So that pan happened there, but obviously it was gili subari.
Okay, if you could give one dental tip to every 10-year-old child, what would it be?
10-year child, eat 100 chocolates, but brush 100 times, brush your teeth well, smile often.
Oh, lovely.
Bilkul.
Would you rather go without brushing for 2 days or without coffee for 2 days?
Without coffee for two
Without
days.
coffee for two
Yeah.
days. Okay. What's more important, a perfect smile or a healthy gut?
A healthy gut.
Healthy gut.
Yeah. It's a healthy gut brings a perfect smile.
Perfect smile. We'll get a perfect smile.
Yeah,
Eventually it will.
Yeah, it will.
What's one dental myth you wish people would just stop believing?
That the teeth fall as you age. Just like hair, the teeth will also fall one day. It's a myth.
It's a myth.
It's a myth. The teeth are supposed to live lifetime, as long as you're living. So teeth do not fall, just like hair fall.
Okay. That's a good one
Yeah,
actually.
yeah, yeah.
तो मैं भी
Teeth are-
मतलब नॉर्मली ये कहते हैं ना बट
हाँ
इसलिए
उम्र हो
इसलिए
गई
और
तुम्हारे
उम्र हो गया
दांत तो गिरने ही है अब
अब
तो
गिरने
बूढ़े हो गए
टूटने
अब तो
हैं,
गिरने
हाँ।
ऐसा नहीं है दे आर नॉट सपोज टू फॉल दे शुड सर्व योर लाइफ टाइम आई सी अ जेंटलमैन he's from a Shankacharya mutt
Okay.
living in Himalayas. He is 20 he was 21 years old at the time when I saw him 4-5 years back. He comes once a while. So before he come, there is a bit protocol done. My whole chair is covered with a cloth piece, and then उसके ऊपर एक आसन बिछता है. उसके बाद वो आते हैं, वो बैठते हैं, मैं उनके दांत देखता हूँ. Amazing teeth, madam. Not even a single cavity, beautiful, neat, clean,
Wow.
white.
Wow.
And I ask him, what do you do? He has never taken an. आज तक अन्न का एक भी दाना. अन्न is I think all the
रोटी
चावल कुछ नहीं खाया.
कुछ नहीं मैदा
He's only
आटा,
on
कुछ-
fruits and milk. And the tej on his face is so amazing. It's so mesmerizing. But only he has taken fruits and milk, and that too in obviously less quantity. Honestly, brushing he doesn't have any concept of it.
He has no
never
concept
brushed.
of
He's
brushing.
never brushed. He has done a lot of rigorous.
pulling.
सिर्फ उन्होंने बोला कि पानी से क्लीन करता हूँ, लेकिन मुझको लगता है कि वो जो फ्रूट्स खाते हैं तो एवरी टाइम इज ईटिंग अ फ्रूट ही इज अननोइंगली ब्रशिंग हिज टीथ बिकॉज फ्रूट इज fibrous,
Yes.
thick, it's hard. So it's just eating it, chewing it. Even an apple a day keeps the doctor away. कहते ही हैं.
बिल्कुल.
You eat an apple, and then you see when you are chewing it, it is cleansing all the teeth, all the plaque,
All the
which
juices
is there.
coming out of it.
So this is a myth that my teeth should fall, will start falling as I get old. No, it's not like that. My one tooth has fallen, so now everywhere, if the whole cascade will happen, no, it is not.
It's not going to happen. ठीक है. So अब one Bollywood song जो आपको अच्छा लगता है, which you probably think when you're doing the surgery or probably you're planning for some difficult surgery. या किसी difficult
One
cases.
song which I really love is फूलों के रंग से दिल की कलम से लिखी तुझे रोज बाटी कैसे बताऊं किस किस तरह से. I can sing also.
Please do that.
Huh?
Please.
फूलों के रंग से दिल की कलम से तुझको लिखी रोज बाटी कैसे बताऊं किस किस तरह से पल पल मुझे तू सताती तेरे ही सपने लेकर के सोया तेरी ही यादों में जागा तेरे ख्यालों में उलझा रहा यूं जैसे कि माला में धागा. बादल बिजली चंदन पानी जैसा अपना प्यार लेना होगा जन्म हमें कई कई बार.
Beautiful,
Yes.
beautiful.
This is the song I love.
So we have a dentist who's a great singer also.
No, it's just the song.
But beautiful. नहीं, our voice is very good. बहुत
you.
अच्छा लगा. This
Thank
is
you.
in fact one of my favorite songs also.
Oh, lovely.
Beautiful.
Thank you.
So, So this has been really a masterclass for me also. I don't know बाकी तो जो सुनेंगे उनके लिए क्या होगा, but मेरे लिए definitely it was a masterclass, learning so much about. I thought I knew something about it, and today I felt I knew nothing about
no, no,
it.
no, no. It's a very interesting one.
Yeah.
I told you I can see a cosmos in a tooth, but well, it's an amazing creation.
तभी तो इतनी सी जगह में इतने सारे स्पेशलिस्ट हैं, मतलब एक डॉक्टर नहीं है इसके लिए,
बिल्कुल,
they are
बिल्कुल. There are
multiple kind of
multiple
doctors for it.
doctors, and every tooth is a patient, and the structure of the tooth is amazing. It's so soft and lively inside, and outside it is just like a very hard structure on the outer surfaces. Inside जो उसका core है वो बिल्कुल nerves, blood vessels. It's amazing. It's a portal of entry into our body, and it is protecting everything.
Beautiful, beautiful. It's really, really nice. So I think to conclude it, मेरे अभी कुछ favorite lines from a song, which is one of my favorite. मैं गाऊंगी नहीं, पर मैं बता
Yeah,
देती हूँ.
sure.
Which is बड़े अच्छे लगते हैं. ये धरती, ये नदियाँ, ये रहना, और तुम.
Yeah. It's a lovely song. Yeah,
It's a lovely song.
अमित कुमार जी ने गाया है शायद.
ये गाना मतलब I think
बहुत ही सुंदर है और
बहुत ही सुंदर है.
पिक्चराइजेशन भी बहुत अच्छा है.
बहुत
Along
अच्छा
the river, I think.
And that girl just asking और कौन? और तुम.
Yeah.
So beautiful. So I think just to sum it all up, we must brush twice a day for our oral hygiene, and flossing कर सकते हैं तो बहुत अच्छी बात है, oil pulling कर सकते हैं या water rinsing कर सकते हैं. We must do it. मीठा खाने के बाद especially we must brush our teeth. That's I think very important.
Or rinse.
Or rinse with water.
Take a sip of water. किसी के घर गए, मीठा खाया, just take a sip of water, swish it and gulp it in. That's
so wonderful. Anything else that you would like to add that we've missed on or something like that?
Don't be scared of dentists, madam. People come and say, I hate dentists. Well, don't hate dentists. You may hate dental treatment, but the first word is, it's a very common, I hate dentists. Well, don't hate dentists. Hate a dental treatment. Good. So, to wrap up the whole thing now, for our listeners, please open wide. Just don't open wide your mouth, open your mind also. Your oral health is not about vanity, it's completely your vitality. So take care, stay tuned, and do keep on watching us, giving us a lot of love. Thank you so much. This is Archna signing off today.